I'm Robert McKay, a member of the New Brunswick Common Front for Social Justice. I'm speaking with Jennifer Laidley, one of the authors of the latest report on welfare in Canada from Maytree, which is a Toronto-based organization. Briefly, Jennifer, what does this report tell us about how social assistance in New Brunswick compares to the rest of the country?
Well, hi. I'm happy to be with you today to talk about this. What we do is we look at um, the total income that for households who are receiving social assistance in each of the provinces and territories, how much their total income is from government sources. So we look at basic social assistance benefits, any additional benefits that people might get that are distributed to all recipients, um, federal tax credits, provincial tax credits, territorial tax credits, those kinds of programs. So we exclude any income that they might be getting from work. Our assumption is that our folks are not working, so we're looking at the amount of money that government programs provide for them,
Right.
which is the case for a lot of people. There are many folks who are on social assistance across the country who aren't working. So this is an important barometer of kind of the baseline of what people can expect to receive when they're receiving social assistance in the provinces and territories. And in New Brunswick, we can see we have a what we call the All Canada Overview section in the report. One of the four households that we look at is called an unattached single considered employable. So that's considered employable by the program, right? They don't qualify as a person with a disability, is in effect what that means.
Mhm.
And in many instances, people are expected to work or to pursue some kind of work-related training. So they're considered employable in that way, despite the fact that many folks have quite a distance from the labor market and they need additional supports. Like there are many reasons that people receive social assistance, and being out of work is only one of them. So in New Brunswick, sorry, that was a long, a long introduction, but I needed to set the context there a little bit. In New Brunswick, we find that an unattached single who's considered employable by the program receives a total of a little over $8,000 from all these government sources that we're looking at, and that's the lowest amount for an unattached single across the country. That's also the lowest. It's also the lowest for the other three household types that we look at, and that is an unattached single with a disability, a single parent with one child, and a couple with two children. So New Brunswick is kind of at the very lowest end of provision among the provinces and territories.
Exactly, and again, as a person who myself, I live on social assistance, so I can attest that it is the bottom of the barrel. And with the runaway inflation that we've had in the last several years since COVID, and the discovery, the fact that Canada and probably international investors have discovered the wonders of buying real estate in New Brunswick. There's so many people who would be on social assistance. There's a number of people who were just upended when buildings were bought and sold and rents were jacked up extraordinarily. So you can't survive. You can't live on. You can't have any kind of a life on this kind of an income except living in a rooming house or with other people. You can't have an independent life on this kind of an amount of money.
Yeah, and I really appreciate that lived experience perspective on this, because we look at all of the numbers, and it's important to ground and situate all of this discussion in the real experience of people. One of the ways that we do look at the issues that you're talking about, is by doing what we call an adequacy comparison. And so we compare these the total incomes to the poverty line. The government of Canada has established the market basket measure as the official poverty line back in 2018. And so we've been doing comparisons with the official poverty line to see how welfare incomes compare. And in every instance across the country, people, except one actually, people are living under the poverty line. In New Brunswick, we also do a comparison with what's called deep income poverty, and that's 75% of the poverty line, which is even worse, which is, even more straitened circumstances. But it's one of the markers that the federal government uses to track their progress on reducing poverty. In New Brunswick, that total income of little over 8,000 for the unattached single considered employable is about, I don't have my number right in front of me. It's about 10, I think it's about $10,000 lower than the deep income poverty line. So it's, people are living in extremely straitened circumstances, as I'm sure you can attest.
Yeah, I kind of like to call myself a third class citizen because I get about a third of what I need to, hit the deep, or not the poverty line, the market basket measure basic poverty line. So switching gears a little bit here. Um, so the Minister of Social Development, Jill Green, recently acknowledged that social assistance in New Brunswick appears low based on this report. According to the Telegraph Journal, Green said, quote, our support amounts look much lower, yes, especially if you look at the single employable individual. That rate is lower than in other provinces, but that doesn't take into account all the other benefits that are potentially available to them. So our benefits that we provide are quite tailored to individuals and their needs, unquote. She mentions examples like insurance for prescription drugs and dental work. What's your take on the minister's comments about the limitations of this report?
Well, I mean, she does have a point that we don't look at the other benefits that are available to people through, what's often called special benefits, and um, and that's because the report. I mean, the methodology for this report was established back in 1986, and so we've got a very long time span that we've been looking at welfare incomes. So she does have a point that we're not looking at other special benefits, but the difficulty, I suppose, with that is I mean, we don't look at special benefits in New Brunswick, but neither do we look at special benefits in any of the other provinces or territories. Just about every province and territory has the kinds of benefits that the minister is referring to that are available for people. Um, Either the medical benefits, getting a health card, having drug coverage, those kinds of things, which are critically important. I cannot stress that enough. Having access to those kinds of health benefit is really important for folks on social assistance, despite their, oftentimes their limitations. But uh, we these are the kinds of special benefits that are available typically through special request. You have to make a special request to your caseworker. You have to document the need. Oftentimes, you may have to have a medical health provider establish that need for you. You may have to, write a special report about what the need is. Um, so there's typically a long and sometimes onerous process that people have to go through in order to access these kinds of benefits.
Yeah.
As I say, these kinds of special benefits are available across the country, so it evens out that we're not looking at any of them.
Mm-hmm.
And of course, as I say, the difficulty is that oftentimes access to these kinds of special benefits is pretty prescribed. And I should note that typically, that these are benefits that are typically intended to pay for very special particular items like funerals, for example, funeral costs. Um, uh, you know, there are other kinds of things, smoke detectors, household furnishings, those kinds of things. Those are all really important, but they don't help people pay for the rent and get food on the table.
In a previous article in the Brunswick News or Telegraph Journal, there was a comment from somebody with the Coalition for People with Disabilities. You were quoted in a small way about in that story as well, but it talks about the medical-oriented benefits. Say you're getting a round of medical treatments in some place, and you need to get that pre-approved. Okay, and so the person mentioned that people can face barriers in accessing a medical professional to secure the proper paperwork, and or the authority. Like I've seen that a nightmare scenario. I've seen that many times where people just can't get. You try to get a doctor today to
Yeah.
take time
Yeah.
out to do anything for you, let alone something in great detail. It's very difficult for that to happen. Is that a thing across Canada?
Oh yeah, I'd say that that's a thing. access. It's interesting, as you were saying that, I was thinking about the assumptions that are made about people and about systems by welfare systems and their administrators, that sort of stand in the way of these systems working as well as one might hope that they would.
Yeah.
So, for example, what you were saying earlier about the housing crisis. I mean, there are assumptions made that housing is relatively cheap and relatively plentiful, and that people have access to decent housing, and that's simply not the case. There's an assumption made that there is access to primary health care, that people can get a doctor relatively easy, and that they can um, that they have access to the kinds of specialists that they need in order to document the need that they have, uh, so that the program can further support them. Um, there, you know, we need to have a look we need to have a look at these systems and the supporting kind of infrastructure that surrounds people that isn't working. So not only is perhaps the welfare system not working very well, but the other additional support systems that people rely on in order to get support through the welfare system, those systems aren't working very well either. So a lot of work needs to be done in order to not only increase people's incomes, but also to give them the kinds of support that they need, to get back on their feet and move forward with their lives in the ways that they want to.
Yeah, and I had a recent experience. I'm giving some ad hoc peer support, let's say, to an individual in my building whose health is pretty precarious. So I ended up riding with him in an ambulance to the Moncton Hospital, where he was seen for 5 or 6 hours and then released. And so we're sitting outside, or we're outside the hospital, and how are we going to get home, right? And so I said, no problem, I'll pay for a taxi. And I had already talked with the case manager a few days before about the eventuality of this happening. So then when it comes time to ask for reimbursement, uh, the timing was exquisite, because the minister had gone and come out and saying about all these extra envelopes of money that were there, and I'm asking for $10.30 to cover that taxi fare because this guy was in no position to walk home. Nope,
Right.
we don't have it. You, notwithstanding that paperwork has to be done for certain things, she said, no, we can't reimburse that thing. So when you talked about assumptions being made, I'll twist that context of the assumptions being made, and the assumptions being made that people are just going to get home somehow. The assumptions being made that if somebody has $10.30 in their pocket to look after a person that's in precarious health, I'm assuming that should be covered. But no, they don't do that, and so it was really something. It just made me angry when I saw the minister saying we've got all these other things, and my experience, like the comment that was made in the Telegraph Journal, it's like the Spanish Inquisition, to be able to get something out of the department. Some people do, but that has not been my experience in that regard. So
And and that experience is critical. I mean, people like me can look at numbers and can, assess policies and can look at them from our positions, but the experience of people like you on the ground is really where the rubber meets the road, right? And if those experiences demonstrate that the system isn't working properly, then work needs to be done to make them work properly.
yeah, and one last vignette that I'll kind of throw in was from my time in Toronto, and I remember when, like, the special diet thing that happened so many years ago, and people that had a need for a special diet and they couldn't get through the paperwork and yada yada yada, and all of a sudden some medical doctor or two, I believe from St. Michael's Hospital, perhaps Dr. Block it might have been, at any rate, they had sign-up clinics on the lawn of Queen's Park, if you'll recall that. And it was, to me that was wonderful, but it was a stunt in a way to just to show the craziness that you cannot get these things being done. And then when doctors actually came to the bat to do this, and they started doing it en masse for everybody, the department cracked down on them, and you know, so those special diet allowances that most people should have anyway just got stopped. It was stopped by the department. So it seems sometimes you can't win for losing.
Yeah,
Which,
I mean, I think that, I think that a large part of that effort was about ensuring that people had enough income in order to, live a life, in order to try to live a life of dignity. And, that was an interesting way to kind of, you know, work within the system's parameters in order to try to get people more money. What I think really needs to happen is that governments need to invest more in basic benefits so that,
yeah.
those kinds of situations don't have to happen, and that people can actually afford to pay for their basic needs.
Well, Maytree this year has done a very great service for the people of New Brunswick to point out where we're falling short. Um, are there any other comments that you'd like to put on the record for now, or
I don't think so. I mean, I think that what I just said is where I might leave things, and that is that you know there is the federal government has established targets around reducing poverty. People on social assistance make up somewhere around 40% of the people who are living in poverty in Canada. So if we want to effectively reduce and eliminate poverty, we need to deal with the very low incomes that people on social assistance are receiving from those programs. So, and in the New Brunswick case, we can see that that need is particularly urgent.
right on? Well, thank you, Jennifer, and thank you to the viewers for joining the New Brunswick Media Co-op. We have been speaking to Jennifer Laidley, one of the authors of the latest report on welfare in Canada. I'm Robert McKay of the New Brunswick Common Front for Social Justice. Thank you all.